Now we're looking at the facts from where we left, that is from point 26 to 75. So the point 26, it is that the major nerve that exists in the obturator foramen, as the name suggests, is nothing but the obturator nerve. Next, the splenic flexure is the most common area of ischemia of the GI tract, and it is caused by the watershed area caused by the superior or the inferior mesenteric arteries. Next, point number 28, it tells us that the most common side effect of the SSRI is nothing but an orgasmia. Next, in cases of the PCP, it inhibits the NMDA receptors and it leads to the aggressive or detachment, and there is loss of the coordination and paranoia as well as hallucinations. Next, in case of the major depressive disorder, it requires a period of 2-week period and of symptoms. This is for the diagnosis to be made. And moving ahead, in cases of the low level depression and for at least 2 years, this is known as dysthymia. And it is other point to know is that it is never the right answer to tell someone else about your patient. So basically the patient confidentiality should be maintained. So unless they give a verbal or a written permission, the patient information cannot be given to others. So this is nothing but the patient confidentiality. Next, anorexia is seen when a patient is BMI is less than 17.5. And next, the most worrisome complication of anorexia and bulimia is nothing but the electrolyte disturbance or abnormalities. In case of point 35, stabilizing a patient in case of the acute mania, it can be done with the help of lithium or valproic acid as well as carbamazepine. And in case of the long-term management for the bipolar disorder, Here there is administration of lithium. And to know, lithium is a very small therapeutic window, and therefore the levels must be drawn frequently. Next, looking at point 38, that is, the patient complains of anorgasmia or low sex drive while on SSRI. In such case, they can be switched to bupropion. Point number 39. In cases of the bradycardia, dry membranes, or mydriasis, they are all common findings in case of the opiate intoxication. Bradycardia, dry membrane, and mydriasis. Now looking at point 40, in case of OCD, it is an outward manifestation of internal anxiety, and then the patients are aware of their problem. And in case of OCD personality disorder, characterized by preoccupation with neatness, and the patient is not aware that they have the problem. This is concerned with OCD. Next, in case of generalized anxiety disorder, it is characterized by minimum of 3 for at least characteristics of at least 6 months in a row. It's not just any 6 months, but 6 months in a row. Next, point number 42. In case of the cleft lip, it is a result of the failure of maxillary prominence with the intermaxillary segment, and here the cleft palate is a result of the failure of the fusion of the palatine shells of the maxillary prominence with the primary palate. Next, 43. In case of the Alzheimer's disease in elderly, it is associated with the E4 allele of the apolipoprotein. Next, looking at point 44, the Turner syndrome is the most common cause of primary amenorrhea, and the genetics of disease is nothing but monostomy of 45XO. The probability of child to get an autosomal recessive is about 3/4. The probability that a child is a carrier child for an autosomal recessive disease is about 1/3. The probability that the child gets an autosomal dominant disease is 3/4. Next, all sons of mothers who are carriers of the X-linked disease, they are affected. All daughters of fathers with the X-linked disease, they will be carriers. There is different phenotypic manifestation of the same disease is known as pleiotrophy. The most common cause of the mental retardation is Down syndrome. The most common cause of the neonatal mental retardation, or the most common cause in case of mental retardation only in case of males. This is the Fragile X syndrome. Now, looking at the next, a delta F508 mutation. It affects the CFTR gene in case of cystic fibrosis, and this is an ATP gated transmembrane protein dysfunction. Next, looking at the surfactant is released from type 2 pneumocytes. The most abundant pneumocyte is the type 1 pneumocyte.